welcome back, everyone. I hope everyone enjoyed their break. I hear a couple people coming. Hello, welcome back. MD candidate. I'll be starting my first year of medical school this coming fall. But for the past 2 years, I've been working in an emergency room. And I noticed that there are certain trends and in terms of emergency flow. And I was able to align this interest with the chief resident at UC Davis's medical center, where he wanted to investigate the temperature fluctuation effects on the plastic surgery trauma volumes at this trauma center. And so, according to a study at Boston's Trauma 1 Medical Center, there's a strong correlation between maximum daily temperatures and trauma admissions. An orthopedic study in the UK showed a statistically significant dependence on maximum and minimum temperatures for both pediatric and total admissions. And seeing a strong correlation between the trauma volumes and other medical specialties and temperature, we sought to study the effects of temperature on the plastic surgery trauma consults. We did this by conducting a 5-year retrospective review of 3,055 electronic medical records for both maxillofacial and hand traumas at the UC Davis Medical Center. Mechanism of injury, dates, and demographic information were extracted from the electronic medical records. Mean maximum temperature from the Sacramento Executive Airport was gathered from the National Oceanic and Atmospheric Administration. And so we hypothesized that as temperature increases, 1, number of hand and maxillofacial consults will increase. 2, most consults will occur on the weekends. 3, young adult males will be the most prevalent. And 4, aggressive behavior will increase. Bless you. To answer our first question, which was, does the increased temperature result in an increased number of consults, we plotted temperature and the number of consults over time. And as you can see, wherever there's a peak in the temperature, there's also a similar peak in the number of consults. Doing a statistical analysis with the Pearson's correlation and a paired two-tailed t-test, we found that there was a strong positive correlation with a p-value that was less than 0.01. To answer our second question, which was, do the majority of our trauma consults occur over the weekend, we plotted trauma volume on the y-axis and the days of the week on the x-axis. There was strong evidence showing that the proportion of trauma cases were higher on the weekends as opposed to the weekdays, and there was a 16% risk in trauma consults on the weekends. To answer our third question, we plotted the number of patients divided between males in blue and the females in yellow against age on the x-axis. This also showed that there was a strong relationship between trauma and gender and age with a p-value that was less than 0.01. With 33% being early adult males followed by middle-aged males. In order to study the effect of temperature on mechanisms of injury, a census of different mechanisms were compiled for the high temperature months and was compared to the low temperature months. The common mechanisms of injury were due to fall accidents, aggressive behavior, industrial accidents, sports-related injuries, animal-related injuries, and transportation accidents. During the high temperature months, The majority of the plastic surgery consults were due to transportation, followed by aggressive behavior. And when we compared the high temperature months results to the low temperature months results, transportation-related injuries decreased by 10% from 34% to 24%, while aggressive behavior remained essentially the same. Therefore, transportation-related injuries appear to be more temperature-dependent. However, this data was not supported by statistical analysis. So in conclusion, there is a strong correlation between temperature and the number of trauma consults. The highest volume consult days were Saturday and Sunday. Transportation-related injuries, or the majority of the trauma consults were adult males, and that transportation-related injuries were more temperature-dependent. And such implications will be useful for planning, staffing, and resource management during the hot summer months. Thank you. Any questions? Yes?
So how big is the sample size?
The sample size was 3,055 charts that we reviewed.
Throughout how many years?
5 years. Yes, correct.
Do you guys have a plan to expand it to other medical centers in different regions, so whether they have similar population?
Yeah, definitely. Increasing the sample size would improve, especially in terms of